So welcome to the National Association of Environmental Medicine webinar series. We are happy to have you here tonight. We have an exciting panel tonight. We're doing a little bit of a different format. And as you know, the topic is hand sanitizers, what's behind the bubbles. And boy, has this been a relevant topic for the last year. So I'm really excited to have our panelists here tonight. Each panelist is going to present for about 10 minutes and then open it up for a panelist discussion and then, of course, Q&A. So as we're going along, please type any questions you have in the Q&A section, not the chat section, but the Q&A section. And we will open it up and make sure to get to all of your questions at the end, and we should be done just about at 6 p.m. Pacific time, so just about 1 hour. So we're really excited to have you here, and I am going to go ahead and turn it over to Amy Ziff. Thank you, Amy. We'll let you go at it.
All right, thanks so much, Beth. It's great to be here, and I am privileged to be with two of my advisors from Made Safe, Dr. Perro and Dr. Fine. So this should be really fun, and I look forward to sharing some of our work with you. You might be actually asking yourself, who is Amy Ziff and what is Made Safe? So let me share a little bit about that with you. Made Safe is an organization I founded 6-ish years ago. It's about 10 years in the making. And at Made Safe, we like to say what we do is make products safe and keep families healthy. And the way that we do this is by employing something called the ecosystem approach. And that is a rigorous scientific process that we've devised to evaluate what goes into all of the stuff that we use each and every day. I like to say, if you kind of think about what organic is for food, Made Safe is for the rest of the stuff in your life. And so we can actually evaluate what goes into the things that we're using on a daily basis to ensure that we are not using ingredients with known endocrine active ingredients, all of those, behavioral, developmental, teratogenic, reproductive, neurotoxic ingredients, likely and probable and known carcinogenic materials, high-risk pesticides, toxic solvents, and harmful VOCs and the like. You get the idea. We're avoiding all those big bad chemicals. And it's always shocking to people who say, but isn't that already done? And the answer is no. It is not. And so this is a little bit about our ecosystem focused process for screening. We're looking at whether or not the inputs, materials, substances, what's been done to an ingredient and its sub-ingredients. We want to know whether or not, first and foremost, it bioaccumulates. Is this going to be harmful to humans? That's a really important sort of measurement to look at that bioaccumulation and how it behaves. We look also at how it behaves in the environment. So we want to know, does it readily degrade? How does it behave in air, soil, sediment, water, all of those things. Then we're going to look at terrestrial toxicity and how it impacts wildlife and the flora and the fauna. What about harmful effects on humans? We look at those. We look at aquatic toxicity as well. And then we're looking at problematic contamination, which comes into products, sadly, all too often. And none of that stuff goes on labels. And what happens is most companies are just primarily focused on human health, but they're not necessarily focusing on it the way we do, and on down the line. And so we feel like it's super important to create a safe and sustainable future where all things within the ecosystem can thrive. And the only way you can do that is by looking at all of it and using that as a tool to do and get better. So that is the really robust work that we do at Made Safe all day long, every day. I wanted to also talk about our banned list briefly. Some of the chemicals we will be talking tonight live on our banned list. This is a list of 6,500 ingredients that are prohibited from use in products that are Made Safe certified. And we sort of throw down the gauntlet to say to any company that wants to be considered clean, they shouldn't have or use any of these inputs in their products. It's compiled from, authoritative lists from around the world, government agencies. This is all backed by science. These are known ingredients of harm. And it's nearly 5 times the restricted list in the European Union, which is, far ahead of the US in terms of restricting ingredients. Our EPA and FDA sadly limit about 11. So this is a publicly available resource that can be found on madesafe.org, and it's usable for shoppers as well as companies. So that's an important starting point, and it is the first step in becoming Made Safe certified. So now I'm going to pivot, and that's a bit about what we do at Made Safe and in our work. We work with over 100 companies and have certified thousands of products, some of which are hand sanitizers. So super relevant to this conversation and to the time that we're living in. I mean, I think in a perfect world, at Made Safe, we'd probably say limit the use of hand sanitizers. And yet we find ourselves all needing to use them and using them far more often than we would probably like. But not all hand sanitizers are created equal. And I think that's a really important thing to understand. And you're going to hear a lot more from Dr. Perro and Dr. Fine about micro details, some of these chemicals. So I'm going to skim right over them and just say, we have broad lists of things to avoid. We make this, again, available to educate people and to help them advocate for better products for themselves at home, at work, etc. And so common things to avoid are this, broad category of antibacterials, parabens, which they've been around for a long time and have largely been phased out. They still show up in some things, and they are just an ingredient to avoid. PEGs, the polyethylene glycol compounds, another one to avoid. They're both penetration enhancers, which make them sometimes attractive, but they also are most commonly contaminated with ethylene oxide and 1,4-dioxane, which is associated with cancer risk. So we want to avoid those ingredients: fragrance, quaternary compounds, and artificial dyes and colors, kind of for the same reasons that you would avoid those in foods. You also don't really want them in your products. And then the other common ingredients in hand sanitizers, of course, and the primary active is usually an FDA compliant alcohol. That can be isopropyl alcohol or ethyl alcohol. And people always say, well, are they all good? And I say, well, it really depends. And with denatured alcohols, you have to know what was it denatured by. And so not all, again, of these categories of chemicals, not all of them are created equal. And so, we want to limit and not overuse when it comes to hand sanitizers. And sorry, I'm moving quick because I want to cover a lot of material. So bear with me, you can ask questions later. Hand soap, right? Hand soap is super effective in our first line of defense when it comes to COVID-19. If you have an opportunity to wash your hands or to use hand sanitizer, use hand soap. Even the worst hand soap tends to be better than a lot of other hand sanitizers, and it gets the job done. The soap breaks apart the COVID virus and the lipophilic coating around the virus and just destroys it. It obliterates it. So soap is such a powerful and simple ingredient to use. Same thing to avoid here for the most part is hand sanitizers. I think the one thing I would layer in is the isothiazolinone preservatives. They are a group of preservatives that are impossible to pronounce. And they have, carry a variety of risks from skin irritant and allergen to, endocrine active and potentially neurotoxic. So those are things to look for and avoid. You want these fragrance-free soaps if you can do it, and use that because washing hands properly saves lives. Literally. And then I wanted to move from talking about those things that we're using very personally and in our personal life to something that's not necessarily on that agenda as we talked about it, but amongst ourselves, we felt it was imperative to cover, and those are school sanitizers. These are what our children are collectively being exposed to day in, day out, if they are fortunate enough to be going into some sort of school center for learning, and having a physical presence. And there's no one solution that's being used uniformly across the United States. And I wish there was, because then we could do perhaps the appropriate studying that is needed for all of these. But unfortunately, they're using different methods in different schools, and based on what schools, what the facilities are like, it can be very varied, the results and the impact. So a lot of schools are using spray used to deploy, like a mister, as they're calling them, to deploy the sanitizer. The children are not in the room, but you do have maybe one or two janitorial, custodial staff who are administering this. And these are pesticides, right? And so what we tried to do here on this slide was to break down some of the more common ones that are being used. I know in California, these are being used. They're being used in New York, in these misters. And it's a good news, bad news story. I chose to highlight one chemical in particular, this sodium dichloroisocyanurate. I probably just really botched the pronunciation, do my best on that one, but it's often called NADCC, and it also goes by these other names. But when you study and really look at this chemical, the question you want to ask is not what is the chemical necessarily. You need to understand its chemistry and how it breaks down, because that's what we're going to be left with. And so we're left with hypochlorous acid, which is extremely toxic to aquatic life. It's also an asthmagen, and there are a lot of data gaps around this chemical. If in a perfect world MaidSafe was looking at this, we would say it's not a great one. And then it has cyanuric acid, which is persistent in air and sediment. But, when you look at that compared to the most common use of quats and in many ingredients, you would rather have this one. That doesn't by any stretch mean that it is perfect. And we would prefer on the EPA approved list, citric acid, hydrogen peroxide, thymol, lactic acid, and the alcohols I mentioned earlier as preferable ingredients. But those are harder to deploy at the long range, and they use these others, common chemicals. And so it really brings up more questions than it does answers that we need to be asking, and we need to hold our governmental agencies responsible to getting to the bottom of those. I'm not going to cover this much. It's probably some stuff that you're familiar with, but it's just useful to understand that these are all chemistries for controlling of germs and bacteria, and you don't want to use the most, nuclear option for cleaning. There's cleaners for cleaning, which can be very effective. Then you might want to use a sanitizer for a different purpose and a disinfectant for truly disinfecting. And then I put in some of the chemistry about the way these work, whether it's operating through a membrane disruption like soap, which is really effective, yay, for COVID, or another method. And hopefully some stuff that we'll see in the future as we are seeing more and more probiotic control, just like we're seeing in our own guts, through nutrition. We're starting to see some chemistries for control using probiotics for cleaners, for household cleaners, as well as for personal care, which is interesting. And maybe we'll have time to discuss it, super relevant to the destruction of all of the bacteria that's living on our, dermal layer, given what we're doing with sanitizers. And just a shout out to education and advocacy is so important because this changes the rules. This is how we got triclosan off the market in 2017, phased out in 18 other antibacterials because the FDA had to look at it because they were hearing constantly from, advocacy efforts and market pressure. And so that was removed, and that was an endocrine active, nasty little chemical used in everything from, hand sanitizers to toothpaste and other things. So always, you guys all know this better than any of us, but support a strong immune system is going to be the best bet, especially when you're exposed to more chemicals than you would like, which is, daily in this life that we lead. So with that, thank you so much. I look forward to diving into the conversation later, but I will pass it off to Dr. Perro next.
Thank you, Amy. The terrific setup for me. I appreciate it. And welcome, everyone. I am going to dig right in. I think a lot of you know who I am. I'm Michelle Perro. I'm an integrative pediatrician. I've been at it for a while, and Executive Director of GMOScience. That's my organization. GMOs and pesticides have been my bailiwick for almost 2 decades. I'm not talking about GMOs and pesticides tonight. I know some of you are saying, thank God, for she's shutting up about that. And I'm a co-author of a book, What's Making Our Children Sick, and I'm working on a second book for parents. So that is in the hopper. But what I'm going to delve into tonight are quats, and that's what I call them. And they're quaternary ammonium compounds. They are not new. They've been around since the 1930s. And most commonly where they were used were in food industry. And since COVID, they've kind of made the leap over to hand sanitizers, schools, and now they're interfacing with children. And so most of the stuff I talk about, I like to talk about kids, that, that huge ignored population that I focus on. Most people prefer their dog than kid, but I'm saying kids are my priority. Some of you like them. So let's talk about them. And that's where I keep looking. So they're, as you heard from Amy, they're in personal care products, they're in conditioners, they're in anti-static things, dryer sheets, you'll find quats, baby care products, well, I don't know why. And so they're really pervasive in the world, these chemicals. They're also known as quacks. Quack sounds like something I don't like to talk about too much. I call them quats. So there are at least 8 different chemical compounds that are quacks, but what you want to look at are the ending is ammonium chloride. So you see that ammonium chloride ending, it's usually a quat. And so sometimes there are over 5,000 household products that have quats. So sometimes even for the most astute readers that we are, and I go, oh, I can't believe that one snuck past me. There is something called the NIH Household Products Database that you can search for those searching people out there to see if there's a quat in a compound. So I like that site. So what are they? They're surfactants. They have long carbon chains from anywhere from 8 to 18 carbons. And it's that chemical structure which gives them their sticky quality. They're persistent and they're sticky, and they're not supposed to be volatile, which is an important factor. But what they do is they tag on to dust. They do a little ride along. So when they're misted, they can ride on dust, which makes them inhalational. The EPA created this thing called the N list regarding approved sanitizers and hand sanitizers and disinfectants. I looked at the list, and of the 392 they listed, 205 of those products contain quats. So they are pervasive. So what's the problem with these quats? Well, there's a lot of known problems, and those are mostly atopic. Asthma and various dermatitis are involved with quats. We know that. There's eye mucous membrane stuff, inhalational stuff is not as well reported, ingestion for sure, and it's mostly in workers. And now what about school kids? And so we know about that, but then I got alerted to the work of this amazing woman. I'm going to talk about her work this evening. Her name is Dr. Terry Rubeck. Oh my God, her work blew me out. Because why? Because it was so precise, it was so clean, and her studies were so well done. Who is she? She's a vet and she's a PhD at Virginia Tech. And what she was doing briefly, she was working on another project looking at valproic acid and immune function. You all know it's a seizure med. I used it for a couple of other things. And what she found is she was seeing neural tube defects, both male and female mice. She was working with mice. And she started seeing these neural tube defects opening up mostly the posterior end of the neural tube. She started seeing, even in the control mice, she started seeing neural tube defects. And what she did was called observational science. Like, she controlled for all these factors and she didn't get rid of these neural tube defects. After a year of trying to sort this stuff out, what she found is, at the same time, her institution changed cleaners, disinfectants. So she said, it's the disinfectant. She started doing her study. The rate of neural tube defects went down, but still in the control animals. So she goes, what the heck? So she moved buildings to another building, still found defects. And what she found was that there was residue, this yuggy quat residue that took her forever to get rid of. And when she removed the residue, she was able to get rid of the neural tube defects. It was in the mouse cages. And that was an interesting finding. Okay, going on, she found some things. I won't go into deep things that she found, but in summary, what she found of the mice exposed to quats, so they had smaller litter sizes, they had changes in the placenta of the mice, big and little placentas, and small for gestational age mice, also affects humans. There was fetal loss in the mice and fertility issues. And there was a reduction in sperm by 50%. And this had not been reported previously, these reproductive errors that she was seeing in this huge number of mice. We're going to hopefully put an article up for all you eager beavers out there to read about. NAM is going to be working on that. We'll show you her data, her work. You can look at her work herself. We'll give you references. And, we use mice. We extrapolated to human stuff, right? We use animal studies. And we have similar issues occurring in humans. And she also postulated, and I postulate to you, that if we're seeing these neural tube defects, it is not a stretch to say this is also a possibility for explaining neurodegenerative, neurobehavioral, and neurocognitive defects. These are links. So we also know that between 10 and 12% of couples now are dealing with infertility in the US, and about 10% of children are now born through assisted fertilization. Just saying. Okay. What else did this amazing woman, Dr. Terry, find? She found immunotoxicity. She found increases in certain kind of leukotrienes, specifically IL-6, and I think it was also TNF alpha. And she found decreases in interleukin-10, what calms the immune system down. So there were increases in pro-inflammatory interleukins and decreases in the interleukins that calm the immune response. So this woman, Dr. Rubeck, let me get it right. She then said, hey, what about humans? She did a study looking at college students, 43 of them, looked at quats, various types of quats in their blood, BAC, and I think one's DDAC, and she found 80% of these kids, college students, had evidence of quats in their blood. She found mitochondrial dysfunction and cholesterol synthesis issues. So how does this turn into our kids? Why am I talking about reproductive health in mice? Because this is what our kids are exposed to. Because I just read an article that the UK teachers are saying, hey, before kids return to school, we want them sprayed down and misted front and back before they enter classrooms each time. Well, what are they going to be misted with? Quats. And so maybe they may not be affected now with inhalational issues, dermatitis, et cetera. But Dr. Rubeck also found that there were epigenetic changes in these mice that affected the F0 up to the F2 generation. Indeed. And so you can get epigenetic changes for the offspring. And where have we seen this? I'd like to say, you knew I was going to have to bring that in somewhere. Yes, Dr. Skinner, Washington, looked at those mice again, epigenetic changes, I think up into the F2 changes. These are not benign chemicals. Reproductive errors, look at the quats. So precautionary principle, right, swung to the side of industry, fear, COVID, no kind of consciousness regarding the role of toxicity. Kids are not really a problem with COVID, but the toxicity from the overzealous sanitizing is a problem. There are safer choices. Thank you, Amy. soap and water, soap and water, soap and water, peroxide, thymol, lactic acid, citric acid, caprylic acid, pine oil, some of the essential oils, alcohols. I think Dr. Anne-Marie Fine will talk a little bit about that, but alcohols do cleanse, but then they increase your toxicity from PBAs and other endocrine disruptors, and we'll go into some of that. So just some closing thoughts. And then I love to talk about this and shake everybody up, because when I learned about biosludge, my world flipped, because wastewater treatment plants were not designed to remove quats, among some other compounds. So now they're in the wastewater, they're becoming biosludge, and then they're becoming fertilizer for your food. Thank you very much, unless you're eating organic. And last, I want to close up with this one comment. And my dear friend Howard Vlieger hit me to this article today, published today. I'm like, wait, we've got a panel. And it was mounting evidence from this study. I have the link that the gut microbiota composition in recovered patients from COVID was very different, that COVID patients have a very different microbiota. Well, why is she talking about COVID patients? I'll tell you why. Because these are antibacterial. The effect on your microbiota is probably significant, not well documented. COVID patients appears have abnormal microbiota, and we are using all these antibacterials. Yes, it's an antibiotic, quats, as well as an algicide, aquatic damage. So there you have it. And the effect on the microbiota, we can extrapolate it probably exists. So I think I want to wrap up there. I gave you a bunch. I'm going to pass the baton over to Dr. Fine, and we'll continue on with our panel.
Okay, thanks for that, Dr. Perro. That was a lot of information. I am the Vice President of NAEM, and I'm a naturopathic doctor. I've been focusing on environmental medicine for many years, and I wrote a book mainly having to do with suspicious ingredients in personal care products that a lot of my female patients were using. And this is how I got a deep dive into the personal care product industry and the types of ingredients used and what kind of harms they can do. And so that's a little bit of background on where I'm coming from. But I also want to point out here something kind of more of a global thought, is that in this whole COVID era where no one is really talking about the effect of the environmental chemicals on your susceptibility and how you do if you actually get COVID. And yet there's a lot of data on areas that are very hard hit with air pollution, for example, doing very poorly. And the kind of data that we're seeing drills right down into PM 2.5 and how that correlates. Another ingredient that has been found to be problematic is PFAS, which are the substances with really long half-lives that are increasing the likelihood of severe COVID. PFAS are like stain-resistant articles and Teflon. And so not only are they being found to increase a person's likelihood of developing a more severe case of COVID, but they are also interfering with vaccine effectiveness. They're saying that it's causing immune system suppression, this contamination with PFAS, which by the way is found in about 98% of people, pretty much all of us. They're called the forever chemicals because they don't really break down. So Philippe Grandjean is an adjunct environmental health professor at Harvard University, and he and his colleagues found that there's a specific PFAS called PFBA in the blood that was associated with the increased COVID-19 infections. And this particular one has been found to accumulate in the lungs more than any of the compounds in its class. So why is this relevant? One of the places where PFAS can hide is in hand sanitizer. And you're not going to see it on the label. It's going to be hidden. It's going to be one of the inert ingredients. So I looked a little bit at this, and I found a big supplier of FDA registered, approved hand sanitizer. And sure enough, it's got PFAS in it, and it's got a symbol, a big symbol on it that says basically danger. The signal word is danger. And the three ingredients are ethanol, water, and the PFAS. So, and you won't know particularly if it's in yours, because this is like a really large supplier of hand sanitizer that's going to sell to a company that's going to put their name on it. So there are undisclosed ingredients in hand sanitizers that you may not be aware of, but they can affect you. They can get into you. Another area that hasn't received any attention is that hand sanitizers contain penetration enhancers like the ethanol and the PEGs, as Amy mentioned. And these have the ability, when you have a penetration enhancer in your products, other stuff that you put on your skin has a very fast entry route into your systemic circulation. So the BPA scientist, Frederick von Saal, he did a really elegant study. It's called the French fries study. And what he did is he looked at a group of people who were eating at a fast food restaurant. And so at many fast food restaurants, they stapled that thermal receipt, which is a main source of BPA in people. They usually staple it to the top of the bag, and then you pick it up and you touch it. And then you either take it out to your car and take it home. What are we doing a lot of during COVID? We are eating out a lot or getting a lot of takeout. So anyway, what his study consisted of is what happens if somebody does hand sanitizer before they eat their meal and then touches the receipt and then they get their blood drawn, versus somebody who has a dry hand, no hand sanitizer, touches the receipt for the same amount of time. And this was just an absolutely fascinating study, because what was discovered is that if the hand sanitizer, which I know which brand was used, it's the top brand out there, the absorption of BPA was up to 100 times higher. And so BPA, bisphenol A, is one of the, it's the poster child for endocrine disruption in environmental chemicals. And so it's got a lot of effects on, your thyroid hormone levels, and most people have trouble with their thyroid. It's the #1 obesogen. It's making people fat. It contributes to diabetes, breast and prostate cancer, infertility, recurrent miscarriages. In one study, the women with the highest level of BPA had up to a 9 times higher rate of recurrent miscarriage. That's 900%. And an increase in all-cause mortality, which is really a new study. And that just means we're not looking at it on what does it do to the kidneys or the thyroid, just what does it do on death from any cause. And they found a significant change in all-cause mortality in the people with the highest amount of BPA. So this is not something that you want to, you do not want any more of this in your body. In fact, you want a lot less of it. And so this is something that I think it's critical that the information gets out there, and that we know that touching a receipt after using hand sanitizer is just going to jack up your BPA. So another group of chemicals that I wanted to talk about that are getting into your body are called phthalates, which are found in fragrances. So Amy mentioned fragrances are found, and dyes are found in these products. And so phthalates hide under the cover of the label fragrance, which will be disclosed on the label. You just won't know that a phthalate or any number of other chemicals that are subsumed within that trade secret fragrance, you won't know what they are. But anyway, phthalates are in the products that have fragrance in them, any personal care product, not just hand sanitizer. And phthalates are also endocrine disruptors. They're thyroid disruptors. They decrease testosterone. There's a huge crisis of decreased testosterone in our men today. That's a whole separate topic. It's a diabesogen, it's an obesogen, meaning it contributes to diabetes and obesity. It contributes to breast cancer. It's another reproductive toxin. It contributes to autistic traits in males, as well as some male testicular dysgenesis. And then it also contributes to asthma, allergies, and eczema, which in our population of children are so much on the rise. So you don't want to have products with fragrances in them. And then the parabens are mostly being phased out, which is really good because they're another group of endocrine disruptors. And the things that parabens do in your body, it used to be thought they were just an estrogen, faker agonist, and they actually do more than that. And so I did notice that I looked at some of these labels, and they're now starting to formulate without the parabens. And so you just have to look on the label. In terms of parabens, just look on the label, and if they're there, then you know. Phthalates will never be found on the label, so your hint is the word fragrance, or in Europe or Canada, it'll say perfume. And then PFAS, that's a very difficult one to know, because it wouldn't be listed at all. And then in terms of the receipt problem with the BPA, I advise people to reject or refuse the receipts whenever possible. You don't really need them unless you just made a bank deposit at your bank. You do need that one. Or you buy something that you may want to return. But by and large, when you go to a restaurant or something, or you go to Starbucks, you really don't need that receipt. And so I advise people to just say no to the receipt, but especially not to have hand sanitizer on your hand before you touch it, or even a wet hand. And so that would be the sum of what I want to say about that today. So let's open it up now to questions.
Yeah, and thank you, panelists, for all of your great information. I certainly learned a lot, and yeah, Dr. Perro, I appreciate the tip of looking at ammonium chloride, like anything ending with ammonium chloride. That's a great tip for us to look for when we're looking at labels. Something easy that we can do to avoid quats. And Anne-Marie, unbelievable that this study demonstrated that these PFAS actually can increase COVID-19 infections. And I think the big takeaway really from your presentation, all the presentations, is that not only do we have to be looking out for certain chemicals that might be in these hand sanitizers, right? But also, how hand sanitizers might make us more susceptible then to other chemicals that are not even in the hand sanitizers.
That's
so
true.
yeah. And then Amy, I just wanted to say that I'm blown away by your organization Made Safe, that you're looking at toxicity for all inhabitants of our beautiful planet Earth. It just makes sense to do that because we all depend, obviously we all live here together, and we can't survive with, huge imbalances. So thank you for, making that clear. So yeah, let's go ahead into Q&A. And is there anything that you wanted to discuss amongst yourselves first? Any other comments?
One thing I just wanted to add is that if people are feeling like, oh my God, I'm never going to be able to find something I can use for, anything, you name it, in my life right now, Made Safe has certified products in all of these areas, and they don't contain any of the chemicals that we're talking about. That is the work that we are doing and what we're ensuring. And so as Anne-Marie was talking about that, thing you can't know where that perfluorinated ingredient is hiding, we see that. That's what we get access to by working with companies. They do this voluntarily, and they want to ensure that they're not using those ingredients, or if they are, make a change. And so I like to just give that word of like empowerment. Like, you can do this, and you can't do it 100% of the time, every single thing. Like Dr. Perro said, sometimes things end up in your home and you go, I can't believe that got past me. So even the best of us can be duped, but if you can do it a majority of the time, you're doing your body so many favors, as you all know, to reduce your body burden. So just using that as a go-to and a resource to find named products without these chemicals can be very useful.
Okay, yeah, thank you for clarifying that, which brings me to Dr. Kevin's question. He has a friend that has a 6-week newborn, and they're looking for user-friendly care products, safe milk bottles, etc., not plastic, and wants to know if MadeSafe.org is a good website to check, or and any other sources.
Yeah, we've got a bunch of products on the bottles. I mean, the best thing to do is use you can find glass bottles now, and that is what you want to focus on. And milk storage is still a really tricky thing to do without using any plastic. But yet you can use MadeSafe as a first point of entry and find various things. And similarly to this whole notion of like, we don't have to use and ratchet up our chemical use just because that feels like, oh, I'll use the most powerful thing I can. Like, that might not be right for the moment. I feel like as new parents, especially, we are marketed to for all of these gadgets and goops and things that we have to do for our babies, when in fact, less is more. And you can get very far with a really simple cream for diaper changes. And and I know this intimately because this is how I got into this work. My twins came home from the hospital and were allergic to things I didn't know you could be allergic to, like diapers and wipes and lotions and potions and things that the hospital had sent me home with. And so I learned very personally how to sort of fix what was going on with them. And they were allergic to stuff that was in conventional wipes and things I bought at Whole Foods. And, it took me a while of teasing out what that was, but it was the starting point of tracking chemicals and realizing, oh my God, we don't even know the half of what's going into our things. And it just had me constantly saying, what is the least formulated product I can use for a given purpose, and strip it all back. And that, it served me very well. So MadeSafe is a good starting point for that.
Just a quick word on baby bottles. Glass, absolutely. They have silicone nipples, so you don't use the plastic. Don't ever nuke them like I did with my kids 27 years ago. I used to nuke the baby bottles. Yep, full disclosure. Don't do that. Did that. And again, what we're trying to get away from is processed. So MadeSafe is great. There's a gal named Irina Webb, and she does I Read Labels for You. There's EWG, Environmental Working Group. And basically, I so agree with Amy, you just want to stay away from processed. Even Pampers, diapers, they have a lot of chemicals in them and dioxins, which baby sensitive skin then absorb. Even Pampers are toxic, so you want to use cloth diapers that are washed in as non-toxic detergent as you can find on MadeSafe. And of course, no dryer sheets. All those dryer sheets are toxic. So you see, I agree, less is more. Do what your grandmother did. And that's what I recommend for babies. And again, other people in the family want to feed babies, and you interface a lot with plastic, especially if mom is pumping and storing her milk and freezing it. They come in these nice little plastic bags. It gets a little tricky. And the goal is to stay sane and not neurotic. There is a point of neurosis that you want to avoid. You want to stay balanced, and sometimes you will interface with toxic things. But if you're healthy and you eat well, and those are other tricks, and you can read them on NAM, you can do well. And this is what we teach as integrative practitioners, right? Lifestyle medicine. This is what half the things of what we're doing is called lifestyle medicine. So that is why you join NEM and you join us, and we become stronger together, and we all learn this stuff together.
Yeah, because you're just making me think that's right. Michelle, that those plasticizing chemicals are the bisphenols that Anne-Marie was talking about. That's where you see them. There are at least 54 bisphenols. So BPA is just one of them, and it's the most well-known and the most researched. But in fact, all of them are bad. They're all really the same long chain molecule with this little, A or E or S or F or whatever it is, dangling off the end of the bisphenol to make it, named. And they're all bad. And so, they'll say this baby bottle is, BPA free. The next question has to be, then what was substituted in its place?
So the regrettable, we call those regrettable substitutions. And it's not just the bisphenol family that is guilty of doing this. And it's kind of shocking that the people who were coming up with the substitutions didn't go beyond like the bisphenol family. Like they didn't consider that maybe the problem is with this whole family of chemicals, because you're right, it's an alphabet soup, Amy. It's bisphenol A, bisphenol F, bisphenol A, F, bisphenol S. And some of the studies on them are showing that they're even more toxic than just BPA. And so I like to tell people the BPA free, that is such a marketing gimmick. It doesn't really mean anything, because normally you see it on a plastic item and they're just trying to assuage your guilt by saying it's BPA free. Glass or stainless steel or something like that is going to be what you want to look for, but not any bisphenols or plastics.
Yeah, that's a really good point. And then Bonnie Nedrow, who is actually the current president of the National Association of Environmental Medicine. Bonnie, thank you for being on. Asks, what do we say to parents who have kids in school? What resources are available for them to suggest alternatives to their school choices that are toxic? And I think that's an excellent question, because I think so many parents, I just don't know what to do. And they might, they don't even know how to start like a dialogue with the school. And a lot of them don't have a lot of time or energy. So I think that's a really important question.
It's a really good question.
Yeah, I mean, I'll jump in, but I know Michelle is really active in her community and has resources, but there's certain municipalities that have, I think, taken the lead on some of these issues. So Washington State is very forward thinking, San Francisco, New Jersey. There's organizations like Clean and Healthy New York, where each, and New Jersey, EA.com, NJEA.com. I forget San Francisco's URL, but we can get those and list them. They're good resources. Each one is slightly different. Each one has a different approach, but almost all of them will give you tips on bringing up this conversation with your school to find out where they are in this. As I said, it's sort of a hodgepodge. Everybody's doing something different, and see if they're, at the leading edge using best stuff, or if they're down using the worst, and maybe introducing, like in New York State, there's a whole move on green cleaners and all of that. It's just a little unfortunate because green is so ill-defined, and the EPA defines that very differently than like Made Safe defines it. And so, you have to start where you can and make progress. But I think having people who are willing to have those conversations is so important about pesticides and pesticide usage in all ways around the school.
Okay.
I had the opportunity last year to give a talk in front of our city council on pesticide use in our city. And so I had a little slideshow presentation, and I just looked at the faces of the city board members, and it was clear to me that they had just never heard this information. And it was just so shocking to me, right? And when I got to the part, my kids are older, I have kids in their 30s, but when they were like in grade school, I used to just keep them home on the days that the pesticide spraying was happening at school, because in Arizona, you had to give 24-hour notice of spraying. So I would see that sign, and then I would just keep my kids home. And so when I mentioned this, decades later to the city council members, you could just see their faces blanch, like they don't want that getting out because the schools are going to lose all that money if people start keeping their kids home. So in a very strange way, I think it kind of made them think. And so there's got to be education and people willing to talk to the school administrators, maybe the school board, maybe the city, and they can be tough conversations. I had a really old conversation with my kids' high school where I was trying to get across, you know, the whole pesticide issue because they were spraying. And I was told by the administrator, oh, we don't spray anymore because last year we had a student who was really allergic to it. So that word, like people understand allergies. And so I said, well, you know what? You got 2 more kids coming up the ranks and they're really allergic too, because that was the only way to get, they understood allergy. I would like to think we are past that and we can talk about overt toxicity and loss of IQ points and other things that are going on with pesticides. So I think that, you know, education and being willing to speak up and talk, it's just, it's not fun, but that it does move the ball forward.
You know, I think, Bonnie, once again, you're absolutely brilliant because this just sparked an idea in my brain that is in this panel, what we need to do. Because I've been approached by members of our community, not just the school community, but the organic food industry community here to help them because they were being hounded to use certain products in areas that were organic or clean, and they didn't want to use it. So they asked me to step in as a physician. And I've written letters and reports and did documentation. So, but this takes a very savvy person, Emery, the people that I don't know where they are, or one of those PTA moms. And I say mom and not dad, sorry dads, because it seems the moms are driving this. Just saying, you know, as you call it, when you go to a PTA meeting, it's like all moms. So the moms and the PTAs have to drive this because they don't want their kids exposed to this. And there are safer alternatives, but we practitioners can offer support letters. And what's something that NAM might want to look at is that we have on our website for our members kind of prototype letters for the school, for your local restaurants, for your local stadiums, you know, for public bathrooms, for your town council, with kind of standard letters with documentation. Because here in San Francisco area, where I'm from, San Francisco County put out a beautiful that I'll have the link in our article regarding safer alternatives, and with a great graph and all the alternatives. And that's where I got my list from, the safer alternatives to use for hand sanitizers versus quats. So we can start as health practitioners, become part of the solution and create documents so parents, community members, activists don't have to reinvent the wheel, because we have access to this much quicker than a busy dad and mom with, you know, 3 kids running around do. So I'd say we might be able to step in as a result of these kind of panels and create protocols, formats, standard letters. So Bonnie, we're on it. NAM is on it. We'll take care of that. Next meeting.
Awesome. Thank you, Dr. Perro. Denise has a couple of questions. Do you know if EcoStrips laundry detergent is toxin-free? It advertises being eco-friendly. And then are there safe plastic-like containers of any kind? I don't know who wants to take that question.
I mean, avoid plastic at all costs, every single kind of plastic. I think that there are studies on even the, you know, better plastics. They're all plastic. Plastic is derived from petroleum, and there's yet to be one that is proven not to be, you know, an endocrine disruptor or leaching antimony and other nasty substances. And you're wearing it, and it's woven into your underwear, and it's woven into your clothing and your fabrics and your bedding and all of that. Like wherever you can eliminate it. And I would say Ween Green or another, you know, glass container that has, sometimes you have to get a plastic top, and I can, you know, forgo on that. Don't have the food touching the top, and don't put the tops in the dishwasher, hand wash with soapy water, not incredibly hot soapy water. But, you know, that's kind of the best thing you can do. You can get them at IKEA, you can get glass off Amazon. So they're really readily available if you're ready to make that switch. And like I have these little water bottles and I'm constantly buying them because my children break them, but I won't give them a plastic water bottle. Silicone is better, but it's not perfect. And I don't think it's the answer. It's kind of a bridge from here to the next thing. And we probably don't know all that we should know about it. So it's, depends on the day it was made in Beijing and what the air quality was, what else is going to be contaminated in it. And it's a very porous material, so it's imperfect. So I will wrap that one up. And I've already forgotten the first question. Oh, it was Eco something?
Yeah, it was Eco Strips laundry detergent.
Yeah, I know those Eco Strips because I switched to those. I switched to a brand called True Earth because I wanted to stop using all the plastic and how much plastic you would save. And they're just these little strips. And I researched the company that I used. I'm not on the board of their company and I like what they offer. I think the quality is good. Yeah, you're reducing all that plastic detergent bottles. So I switched to those little Eco Strips myself and no detergent and no softening strips. Those have got to go, those little dryer sheets. Even the clean ones, organic ones, better, but still like just get rid of it, they just have to go. So I say yes, because you can reduce your plastic consumption of laundry detergent. It's huge. When I switched over, I personally, it was 60 like tubs a year, one person of plastic detergent bottles. And I've tried it, and back in the day before pre-COVID, we used to take our empty bottles and refill them up at our local organic store here in town. And now we can't do that. We can't bring our bottles back in to refill them up. So that, COVID has caused this huge amount of waste again. When stores wouldn't let it, making us get all those bags again. We finally were using our own bags forever. But we're getting back to it now, bringing in bags and loading them in your shopping cart and trying to make it work. So I think personal reduction does pay off. I support it.
I haven't seen the Eco Strips, but I'll just give a shout out to Meliora Cleaner, and they are a powder-based detergent, and they ship everything in cardboard. So, you have no plastic there either. They will, if you ask for it, give you like a little scooper that is plastic, but their hope is like you'll carry that over to your next one or your next one for measuring, or use your own, tablespoon measurer. I like that too. And had that experience. You're like, there's no more gargantuan plastic thing in my recycling bin each week. So it's a win.
Yeah, absolutely. I think that I've been so focused on just getting toxin-free laundry detergent that I kind of forgot about the jug, the container. So thank you for those suggestions.
And it's a reminder, Beth, that when we talk about this stuff, it's a journey. It takes a long time to decontaminate and detoxify our lives, and that we're not looking for perfection, but everything you do matters. I have the same food conversation with parents all the time. 50% organic is better than no organic, and it's a journey toward detoxification. We're trying to clear the slate completely, but it takes time because we've accumulated over decades of life so many toxic habits, and you're often fighting family members and friends constantly. You're getting this like 24/7 eye roll. I get it all the time from even family members. I'm not gonna say who they are. They're probably nearby. When I kind of.
I feel so much better hearing that, by the way, I'm just gonna say.
So deal with the eye roll, and and I remember when I switched from saran wrap, which I kind of loved, to these wax-based coverings. Not as good, but I got over it and I adjusted. That the like beeswax wrap.
Right.
So yeah, the plastic is amazing, but it's not safe.
Yeah, and I say this to my kids every day, all day long, but I'm like, why did you use that plastic? That thing you're using, it's disposable. It will last for more than your lifetime and mine combined, and probably all of us on this call. Like that one little saran wrap is going to last for well over 100 years, possibly several hundred. And some plastics will last and not degrade for well over 1,000 years. And that to me is just like, I just can't, you forget about all the toxins in it. I feel like sometimes my kids can get their heads around like 100 years sounds like a really long time.
Well, that's where we have the conversation, the cost of convenience.
Mm-hmm.
And there is a big cost, and the cost is our health, and our kids will not have as much longevity as we do. That's clear. The rate of illness is so profound in our children. It's even much higher than the original 54% I used to quote, a couple of years ago. It's higher now of chronic disease. And now they will not live as long as we are, our children.
And one of the things, this conversation, and it's, the end of the hour or whatever, but made me think for both of you was, who is measuring and looking at and assessing all of the exposures that we're getting for these, through that we just talked about tonight, the hand sanitizers and that constant, every place you go is doing some sort of disinfecting. And so we are probably being exposed to it more often. And remember those quats in the story. I mean, when I first read that study from that you talked about tonight, Michelle, I remember being like, oh my God, and the multi-generational effects, and like, what have we done and what are we doing? And it stayed with us. And actually that was one of the first really definitive studies on quats that we could extract widely to a variety of quats. And that was when MadeSafe made a rule that was like, okay, we can't just call out, these ones, we have to kind of look at this as a category. We'll entertain others. But anyway, my point was more like, how are we going to see, those rates of morbidity or, cofactors and diseases and all of that? Like, when will we see those studies based on, this time that we've lived through and the effects of it, the chemical impact?
Well said. And of course, not to mention synergistic toxicity. There's nothing on it. Even when I talk about Roundup, well, you eat at least a food would at least average 6 pesticides, and there's no common. And then when you factor in, the phthalates and the parabens and the quats and everything else, there's no synergistic studies, and they don't want to look at it because
right. Industry is not going to put that forward.
No. I don't know if do we have time for one more question? Denise has another question. What can nurses and doctors do who are filmed to make sure that they sanitize their hands in between patients? I don't know if they can use their own hand sanitizer if they're in a hospital. I don't know the answer to that. Anyone?
Well, we were just talking about that before we started the webinar, because that just freaks me out. I was watching a film on labor and delivery nurses, and you can imagine L&D nurses, how many times they're washing their hands, might be 60 times a shift, and then re-sanitizing with that goop. So to fight a hospital, I think is going to be really hard, because hospitals use the most toxic substances. That's clear. And I think, healthcare providers in hospital settings have some of the highest rates of toxicity, no doubt. So what I say is, you have to show them how you wash your hands when you go in the door, then you go in the patient's room, soap and water, rinse it off quickly and dry them. Mm-hmm. That's what I say. You've done it, then you just do soap and water when you go in the room, with a patient's room, and then you soap and water, and then you have to, then after you sanitize on your way out, quickly get back to the sink and rinse it back off. Because the longer it stays on your skin, especially if it's moist skin, it increases systemic absorption. As you heard from Dr. Fine, drier skin, you have less absorption. What Dr. Rubeck said is that skin doesn't absorb much unless it's abraded, eczematous, chafed, and it's wet, which increases absorption. And so who has chafed hands? Healthcare professionals, artists, children, right? Their hands are in everything. People who bite their nails. 1 out of 6 kids bites their nails, right? Absorption, increased absorption. 1 out of 12 adults, right? Biting. So I'd say, and if you want to be that nurse, that doc, good luck, but you can create, a concern committee. Personally, I wouldn't waste my time. I think they're really hard sells, particularly in this COVID era. I think it would be a really hard sell. Everyone is on hyper vigilant alert right now for desanitizing environments like hospital and PPE and everything else. I don't think it's going to happen, but you have to protect yourself. So there's no one who says you can't do soap and water once you enter a patient room. There's nobody who said that, as far as I know. And some of you might go out there and find that to be not true, but that's what I think.
Okay, good idea. Well, thank you everybody so much. Thank you panelists for your very valuable information and time tonight. I think everybody learned a lot. I certainly did. And thank you for those that joined tonight. There will be a replay available on the NAEM website, which is envmedicine.com. So ENV as in Victor, medicine.com is our website, and we will post the replay within a few days, along with some of the a few links, things that we referred to. So those will definitely be up there as well. And of course, if you're not a member, please join us. We're an amazing organization, and we're really, really out there to support you, to be your valuable resource, your point of connection when you need help. So thank you, everyone, and have a lovely evening, and we'll see you next time.
Thanks for having me. Bye.